Good morning. Today we will see the remaining reasons of medical nursing. So the first one is never elevate. This we have seen already. So next one is the barrier nursing is practice for patients with neutropenia. So what is neutropenia? Neutropenia is an abnormally low count, a type of white blood cells that is neutrophils. There are many white blood cells. Among them, one of them is known as neutrophils, and its deficiency or its abnormally low count we call it as a neutropenia. So what's the functions of these neutrophils? Although all the white cell helps in the body to fight against infections, neutrophils are important to fighting certain infections, especially those caused by bacteria. In those cases, when there is a decreased neutrophils, the chance for the infection will be more. So, we have to practice barrier nursing. The aim of the barrier nursing is to protect the medical staff against the infection by the patients and also protect the patients with highly infectious disease from spreading their pathogens to other non-infected people. That is the aim of barrier nursing. So by following a barrier nursing in patients with neutropenia, we can help the patients to free from infections. Next is blood urea is checked for patients undergoing coronary angiogram. During coronary angiogram, a type of dye that is visible by X-ray machine is injected into the blood vessels of the heart. After the angiogram, the dye leaves the body to the kidney and to the urine. So, an increased blood urea level which indicate that renal function is not adequate, thus it may not be able to excrete the dye and cause accumulation of the dye in the body and may leads to contrast-induced nephropathy, which is following the administration of radiographic contrast mediated in coronary artery coronary intervention. That is why the patients should have checked a blood urea or the renal function test before undergoing a coronary angiogram. Morphine is administered in patients with acute myocardial infarctions. As we know, morphine is an opioid analgesic. It is a potent opioid. Morphine seems to be an ideal analgesic. It has innate hemodynamic effect also during MI. That means it decreases the heart rate, blood pressure and venous return and also stimulate local histamine mediated process. So theoretically, this reduces the myocardial oxygen demand. So two functions are there. First one, it is an ideal analgesic in case of MI and also it reduces the myocardial oxygen demand. Patient with intercostal strain is nursed in Fowler's or semi-Fowler's position. A Fowler's position is a standard patient position in which the patient is seated in a semi-sitting position of 45 to 60 degrees and may have the knees either bent or straight. This helps to facilitate drainage of fluid and optimal lung expansion. Splint intervention site with a pillow while cuffing to minimize the pain. So fluid drains by gravity mixing with water and raising the fluid level. That is why patients with intercostal strains are nursed in Fowler's or semi-Fowler's position. A low molecular weight heparin is prescribed with a patient with a prolonged immobilization. Low molecular weight heparin, in short we call it as LMWH, is a class of anticoagulant medications. They use for the prevention of blood clots and treatment of deep vein thromboembolism because it can be given subcutaneously and does not require APTT monitoring. LMEH have half a long life in blood circulation and more predictable effect after a given dose, require less blood tests to check for the effectiveness and side effect and do not have to be given in the hospital setting. So, in a patient who are prolonged immobilization, they have more chance to develop deep vein thrombosis. So, in order to prevent the deep vein thrombosis, low molecular weight heparin is prescribed for the patients and it does not need regular blood test to check the coagulation effects. Incentive spirometry is recommended for a patient with pneumonia. Spirometry is the most common pulmonary function test. It measures the lung function, specifically the amount and the speed of air that can be inhaled or exhaled. Pneumonia is an infection that inflames the air sac in one or both the lungs. The air sacs may fill with fluid or pus, causing the cough with phlegm or pus, fever, chills and difficulty in breathing. So in case of pneumonia, the respiratory, the pulmonary function will be decreased or diminished. So the incendiary spirometer that helps to loosen the mucus and fluid from the lungs. Incense spirometer can be used in pulmonary rehabilitation for inspiratory muscle training to reduce the breathing difficulty. Monitoring a patient's blood pressure is important when he is on nifedipine. Nifedipine is a class of medication called calcium channel blocker. It lowers the blood pressure by relaxing the blood vessels to the heart. So, in patients who are receiving the blood pressure, in patients who are receiving the nifedipine, the blood pressure monitoring is very important to prevent hypertension, because there are many chances when the patients may go into a hypertension and do the cardiac arrest. So to prevent that, we have to check the patients frequently. We have to monitor the high blood pressure. Biomedical waste management is very important component of healthcare system. Why? Without proper disinfection, the biological waste can cause acute immune deficiency syndrome, hepatitis B, C, severe acute respiratory syndrome, tetanus, psychosocial stress and other diseases. Therefore, the biomedical waste management is critical for protecting the environment and the public health. And also, nosocomial infections in patients from poor infection control practice and poor waste management will occur, and it will increases the hospital stay of each patient. The risk of infection outside the hospital for waste handlers and scavengers, and sometimes general public living in the vicinity of the hospital. Because of these reasons, the biomedical waste management is very important component of the healthcare system. Anasarca is common manifestations in patients with heart failure. Anasarca is a serious condition in which there is a generalized accumulation of fluid in the interstitial space. Accumulation of fluid occurs when capillary filtration exceeds the amount of fluid removed via lymphatic drainage. The damaged right side stops pumping effectively and the blood builds up in the vein. As the pressure increases in the veins, it pushes fluid into the surrounding tissue, and means the fluid buildup causes swelling and congestion throughout the body, and this is known as Anasarca. So the right side, and Anasarca is a serious condition. There is accumulation of fluid in interstitial space, and the patient with the right heart failure, the pumping from the right heart to the pulmonary, the lungs will be decreased, and because of its function, and the blood will be pulled in the veins, and from the blood in the veins, the fluid will be pushed into the surrounding tissue. Anti-retroviral therapy, once started, should never stop. Discontinuation of anti-retroviral therapy or ART may result in viral rebound, immune decompensation, and or in clinical progression. Thus, the discontinuation or planned interruption of ART is not recommended. In addition, stopping the treatment allows the HIV to actively reproduce and circulate in the blood, and is associated with increased inflammation in addition to the increased risk of heart attack and kidney and liver problems. That is the reason why once the ART or anti-retroviral therapy started, it should be never stopped. Thank you. Thank you for listening. We will see in the next session. Okay, bye.